Good afternoon, everybody. We will get started in just a minute. Good afternoon, everyone. I'm Nirav Shah, the Director of the Maine CDC. I'm joined this afternoon by Commissioner Jean Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are pleased to be with you this afternoon, talk about where we are with respect to COVID-19 for this last media briefing of 2021. It marks over 200 media briefings, and starting next year, the fourth calendar year that we as a state, as a community, and as a country, and as a globe will have been dealing with COVID-19. I begin this afternoon's update on yet another sad note. The Maine CDC is reporting 18 additional COVID-19 related deaths today. 10 of those deaths were in men, 8 were women. One was an individual in their 40s, another an individual in their 50s, 3 were in their 60s, 3 in their 70s, and 10 over the age of 80. Of those 18 deaths, 10 of them were from our ongoing vital records review process. Those 10 deaths occurred between December 1st and December 16th of this year. They bring the total number of deaths now associated with COVID-19 in Maine to 1,510. We'd like to take a moment to offer our condolences to the friends, family members, and communities of all of those who have passed away with COVID-19. Statewide, there are now 144,538 cases of COVID-19. Over the past 7 days, our PCR positivity rate has increased and now stands at 12.1%. Much of the reason for that increase is a decrease in the amount of testing that's happened. Our testing volume for PCR tests has come down to 515 for every 100,000. As we'll see when it comes to vaccinations in a moment, decreases in both testing as well as vaccinations are not uncommon around a holiday, especially right now during this time of the year with multiple holidays. A large portion of the increase in the positivity rate is because of a decrease in the testing volume. Right now, across the state, there are 331 people who are in the hospital with COVID-19. That is 50 fewer people than 2 weeks ago. Of those, 109 are in the ICU, which is 5 fewer people than 2 weeks ago, and 53 are on ventilators. That number is 13 fewer people than it was 2 weeks ago. This is an easing in our hospitalization rates, but it is not a signal that COVID-19 has passed or is passing, nor is it a sign that the strain on hospitals is any less today than it was 2 weeks ago. Our state's temperature may have dropped from 105 degrees to 104 degrees. We are still experiencing a very high and dangerous fever. One of the ways out from that, as we've talked about, is with respect to through vaccination. Over the past 7 days, Maine has administered an average of 5,286 COVID-19 doses of vaccine every single day. Now, this is a decrease from where we were, say, 2 weeks ago. But similarly, when it comes to testing, given the holidays past and upcoming, the fact that we are still administering multiple thousands of doses per day across the state is encouraging. We're getting ready for another big year for vaccinations in the first part of 2022. And indeed, there remain several opportunities to get vaccinated. Right now, the Augusta Armory here in Augusta is open today until 4 p.m. No appointment is necessary. And of course, as always, there's no charge to you for getting your COVID-19 shot. There are also numerous other opportunities across the state to find a spot to get your COVID-19 shot, or as we're increasingly learning, to get your booster. And finally, before I turn things over to Commissioner Lambrew, I'd like to take a moment to talk a little bit about updated guidelines from the US CDC around isolation and quarantine. Many of you have probably seen or heard about these updated recommendations from the US CDC. I want to talk today about what these changes are and what they mean for you. Well, let's start with a really quick refresher on the difference between isolation and quarantine. Isolation is what happens after you are confirmed to have COVID-19, after you get that positive lab result. Quarantine is different. Quarantine is what happens after you are exposed to the virus. That is to say, what happens after you are a close contact with someone that is known to have COVID-19. Isolation is what you do after you've got the disease. Quarantine is what you do after you've been exposed. The second thing right at the top is this new guidance that just came out the day before yesterday. Well, who does it apply to? Well, it applies to the general public, not to healthcare workers. Last week, the US CDC also put out a separate set of guidance documents on this same issue, isolation and quarantine, but specifically for healthcare workers and the facilities in which they work. So if you're a healthcare worker at a hospital, at a nursing home, et cetera, there are different guidelines for you and your facilities because of the nature of the work you do. So let's talk about these changes. And let's start with isolation. That is to say, what do I do after I've just tested positive for COVID-19? And there, the US CDC and the Maine CDC are shortening the recommended time for isolation from 10 days to 5 days. But there are some big provisos. This assumes that you do not have any symptoms. It also means that on day 6 through 10, you wear a mask at all times when around others, whether you're at home or whether you're in an indoor public setting or even in an outdoor setting. Anytime you are around others for the latter half or throughout for the first half of your isolation period, the first 5 days, you shouldn't be around anyone at all. For that latter half, from days 6 through 10, you can be out and about, but you absolutely need to be wearing a mask. The other change is to the scenario where you've been exposed to COVID-19. That is, you're a close contact of someone who has COVID, and now you're facing quarantine. What to do next depends on your vaccine status. For people who are unvaccinated or who are more than 6 months out for their second shot of Pfizer or Moderna, or more than 2 months out from your J&J vaccine and who haven't gotten a booster yet, they should now quarantine for 5 days, followed by another 5 days of strict mask wearing. If you have gotten your booster, you don't need to quarantine after an exposure, but you should absolutely be wearing a mask at a minimum for 10 days anytime you are around anybody else. And for anyone who's exposed to COVID-19, regardless of your vaccination status, you should get a COVID-19 test the 5th day after you're exposed. So what do these changes mean for you? Well, the first and most important thing is if you are feeling sick at all, stay home. In addition, the guidelines around isolation. If you're not feeling well, if your symptoms have not resolved, then you are still in isolation. This new shorter isolation period very clearly assumes that your symptoms are resolved and that you continue to wear a mask. The second thing it means for you is that if you get COVID, you've got the ability to return to your life just a little bit sooner, provided, once again, you don't have any symptoms and that you wear a mask. Similarly, if you get exposed, there too, you now have the ability to return out of quarantine just a little bit sooner. The last thing that this means, and this is implicit in the guidelines, is the importance of boosters. Every single day, we learn more and more about the importance of boosters. And that's reflected in this latest guidelines around isolation and quarantine. Boosters matter. They are the safest way to avoid quarantine altogether, as well as the risk that you might infect somebody else. The best way to achieve that is to not just get your vaccine, but also to get your booster. So with that, I'm going to turn things over to Commissioner Lambrew.
Thank you. As Director Shaw said, the stress, while high, has lessened on our hospital critical care capacity thanks to the hard work of our hospital teams, the federal government, the National Guard, and Governor Mills. Today, to extend that support, Governor Mills announced a plan to increase Medicaid, also called Maine Care, payment rates for Maine nursing and residential care facilities beginning on January 1, 2022. This includes timely implementation of improved rates, which were overwhelmingly approved by lawmakers and signed into law by Governor Mills earlier this year as part of the biennial budget. The plan would also reinstate supplemental wage supports and waive certain fees during the pandemic. This support complements much needed Maine Care reforms for other direct care workers across a range of services, including home and community-based services, behavioral health, and long-term care residential settings. From the start of the COVID-19 pandemic to today, our long-term care providers and their frontline staff have done amazing work in close partnership with the state of Maine to keep their residents safe from this deadly disease. We will continue this collaboration into the new year in the short run to help recruit and retain staff, and in the long run to advance state-of-the-art reimbursement and a workforce set of policies that will continue Maine's reputation as one of the best states in the nation to grow old. With that, I'll turn it back over to Director Shaw for questions.
Great, thank you, Commissioner. And we've got a full slate of our colleagues in the media today. And the first question for the afternoon goes to Joe Lawler.
Hello, thanks for taking our questions today. I guess my first question is about the new quarantine and isolation rules. Do they apply to schools? And what does this mean for schools in terms of avoiding school shutdowns?
Yep. Thanks, Joe. As you can imagine, we've been analyzing the guidelines through a bunch of different lenses, including very much through the lens of what it means for schools. And the answer to your question is yes, these new guidelines do apply to students in school settings. And we're working to incorporate those into the next iteration of the document that we use to communicate management of COVID-19 with schools. In short, what this means for school children, to say nothing of teachers and staff, is that if they are fully vaccinated at the age that they are eligible for vaccines, and I can talk a bit more about that important caveat later, Joe, but if they are fully vaccinated for their age category, there too, if they are exposed, they don't necessarily need to quarantine for the same period of time, provided that they are wearing a mask and such things. Similarly, if they get COVID, the time period for which they may need to be out during isolation is shortened from 10 days down to 5 days. For that latter 5-day period, just want to underscore again, got to be masked. It can't have any symptoms. This is a big step forward. Our goal has been to keep kids in the classroom as much as possible and as safely as possible. These new guidelines are another step in that direction.
Okay, just following up to be super specific, and I think you were alluding to this. So there's a group of students, I believe age 12 up to age 16, who would be probably, a lot of them would be past 6 months past their second dose and yet there is no booster available to them. So I think what you were saying is for those students, as long as they had their 2 shots, they would not be subject to the 5 days quarantine.
You're absolutely right, Joe. I clarified and confirmed that with the US CDC yesterday evening. And yes, the way you characterize that is accurate.
And so, but I guess that would also mean for 16 and 17-year-olds that then they would need to have a booster to make sure that they avoid, right?
Yeah, Joe, you asked the exact question that I asked at the US CDC last night. And this gets into a little bit of inside baseball with the way that the US CDC's advisory committee frames recommendations. You remember a month or 2 ago, there was a big kerfuffle about may get a booster versus should get a booster. For 16 and 17-year-olds, right now, the US CDC is on the may get a booster. Thus, it's not recommended. They should get one. Let me be honest. Everyone who's eligible for a question should absolutely, for a booster, should absolutely get one. But the conundrum that you noted, Joe, does not apply to 16 and 17-year-olds because of this may versus should. 16-year-old who doesn't have a booster is still considered good to go, but I still think they should get a booster. Is that's
okay,
clear as mud? I know.
Of,
Again, it's inside baseball, but you're happy to chat with you offline about it if you want.
Okay, this affects a lot of kids, and I won't take up much more time. But just to understand, 16 and 17, if they have their 2 shots, they do not need to quarantine on an exposure. Correct?
That's correct. You are correct, Joe.
Thanks.
Yep. Let me go to Jessica Piper next.
Thank you, Dr. Shaw. My first question is about vaccinations for younger kids. It seems like the number of kids in that 5 to 11 age group who are newly getting the vaccine has slowed down a lot. And I'm wondering if you think that's more about access to the vaccine or hesitancy among parents, and what is the Maine CDC doing to address it?
Yeah, I can start. Commissioner and I discussed this issue quite at length. I think it's a combination, Jessica. We've made pretty good strides on the access front, as you're aware, by hosting clinics across the state, pop-up opportunities on days and locations that we know people will be at. Many of those have been well subscribed. For example, the one we've talked about at the McDonald's in Waterville a couple of weeks ago. So we've done a lot to make sure that the vaccine is easy to access, to say nothing of our colleagues at federally qualified health centers, as well as your local doctor's offices, which are increasingly stocking the vaccine. But nevertheless, we know that there are corners of the state where we got to do more. Hesitancy, or I should just say parents with questions about the vaccine, that's a challenge. We've tried to make sure that if parents have questions about the safety, the effectiveness, the benefits of the vaccine, we've got answers for them. If there are more questions that are out there that are yet to be answered, we're standing by to help.
And are there any plans for more school-based clinics continuing in January or February?
Yes. Okay. Yep, we've been working with DOE. Now, just a level set there too, Jessica, there have already been more than 400 thus far since children became eligible. We're looking to do more in the new school year as well. One of the things we saw with respect to adults is that there was early demand by early adopters of the vaccine, and then a bit of a lull. Parents, or in that case, adults, wanted to wait a little bit of time, 2 or 3 months. Having waited that time period, we then saw another surge of interest. We hope that the same thing will happen with respect to parents and their kids. If so, we want to be ready to meet that demand.
All right. And then switching gears, how is the Maine CDC navigating the fact that it might not be aware of positive cases due to at-home tests? I'll start with that. Yeah.
Yeah, that's not a finding that is unique to the Maine CDC. Every single state and local health department across the country, for every single epidemic or pandemic or outbreak that's ever occurred, has to grapple with the fact that we don't always have 100% visibility. And that's why we build models that help us estimate how much of the iceberg we are and are not seeing. That's another reason why the guidance that we talked about today is really critical. The reason I wanted to go over it today is to equip folks with what they need to know in case they test positive on a home test. Right now, what that means is, it's sort of making sure you know what the parameters are so you can navigate that on your own. We're working to put together a flow chart for folks as well, so that they don't have to rely on what can admittedly be somewhat confusing text. But the central theme that you note, Jessica, is not one that's unique. It's a balance between the value of having easy access in someone's home to testing, which right now is paramount, versus what we trade off for that, which is that state and local health departments may not always have the crystal clear vision as we would have in the first couple of weeks of a pandemic into every single new case. That's a trade-off, but it's one that's well worth making.
And I know we've heard some concerns about kind of just people having trouble finding the test as well as the cost. Are there any efforts to address both of those things?
Yeah, Commissioner, I can kick this one to you if you want, or.
Sure. I'll just begin by saying we appreciate that too. We continue to struggle to identify sites that can offer testing, to make that testing available, accessible, and low cost. Governor Mills was on a call with the president earlier this week, where the president acknowledged the challenges. He said he's willing to work with us. We are willing to work with him, and we continue to explore all options. I think we'll have some news hopefully next week on some new testing sites in Maine. We'll continue to pursue at-home testing options for residents of Maine, and we'll continue to do whatever we can do to make widespread COVID-19 testing available and accessible.
All right, thank you.
Thanks, Jessica. Let me go to Brian at WAGM next.
Thank you, Dr. Shaw. My question was actually just answered.
Great, thanks, Brian. Amy Brown, over to you.
Thank you, Dr. Shaw and Commissioner Lambrou. With the changes that you've been discussing, people at high risk are now possibly at a slightly higher risk. Do you anticipate a recommendation for a fourth dose coming, like second booster coming soon, and or the boosters being included in the definition of fully vaccinated at some point? I know I've asked a few weeks ago and someone else asked last week, but seems more and more like that's becoming evident that it's going to be necessary.
So I'll take those in order, Amy. On the fourth dose, there is one healthcare institution in Israel that, in partnership with the Israeli Ministry of Health, has launched a study to examine the immune benefits of a fourth dose. That just got off the ground a couple of days ago. We are weeks, if not even longer, away from having those data and understanding if there is an incremental benefit behind a fourth dose. If there is, then that's certainly something I know that federal authorities would want to consider as they're making decisions about future boosters. If there's not an incremental benefit of a fourth dose, then that takes us down a different question. It's an empirical and scientific question. We've got to see what the data are. Similarly, with respect to the definition of fully vaccinated, Amy, again, this too is a federal decision that federal policymakers make, but you can already see some hints of their thinking when it comes to the definition of quarantine that I went over a moment ago. If you're not boosted, right, then there's a recommendation to quarantine for 5 days plus another 5 days of masking. But now, only if you are fully boosted at the age tier that's appropriate for you can you avoid quarantine altogether. We're beginning to see that thinking and that notional approach in the approach that federal authorities are taking. I think we'll see more of that, but time will tell.
Great, thanks. And my second question is whether you can estimate what percentage of the cases in Maine now are Omicron somehow, or if you know how many have been detected. I'm wondering if that an increase in Omicron might be behind the decreasing hospitalization rates, if that's starting to take over rather than Delta.
Interesting possibility, Amy. So here's what we know for sure. As of last Friday's genomic sequencing report, we were at least 2.2%. That number is undoubtedly higher now because of the passage of time just since last Friday through today. We'll have the next iteration of that report later this week. Again, I fully anticipate that it'll be at a higher number. I don't know what that number is. I can tell you the floor is 2%. The ceiling, we'll have to see what that percentage comes back at. And in terms of what that might mean for hospitalizations, there too, it's too early to tell. the scientific jury is still out on what Omicron means from a severity point of view.
All right, thank you.
Thanks, Amy. Chris Costa, over to you.
Hi, Dr. Shah, Commissioner Lambrou. Thanks for the time today. I was hoping that you could kind of address, I know as we've talked about kind of these new guidelines, when you talk about isolation is pretty black and white. Stay in a room, that's separate from everybody else. Don't really come in contact with anybody else, even in your own household. Quarantine seems to have a little bit more of, I don't know if I'd call it a gray area, but can you kind of explain what a quarantine should look like for somebody who has to stay at home? Can you come in contact with your kids, your partner, et cetera?
So Chris, I'm going to talk about what you asked me what it should look like, and then I'm going to also comment upon the real world as well. Quarantine, in theory, should look like isolation. The goal, the purpose of it is that you've been exposed and you are at risk for getting COVID and thus potentially transmitting it to somebody in that early phase. So if you need to quarantine, those first 5 days of quarantine should look like the first 5 days of isolation. You should be alone. You should be minimizing the risk that if you develop COVID, you're going to give it to someone else. But the risk of getting and giving COVID to somebody if you're in quarantine is lower than the risk of giving someone COVID if you're in isolation. And if you're in isolation, you've already got COVID. So practically speaking, we know that folks want to see their kids. They want to see their partner. I think it's something that everything right now with COVID is a risk balance. I don't think it's a smart thing to do, but I know that people do it. And part of the motivation behind these guidelines is to recognize that reality and try to work with people a little bit more. Recognizing that on day 7, 8, 9, and 10, folks are fed up. They want to see their family. This is part of an effort to reduce that, still get people to buy into the idea, but do so in a manner that's safe, namely wearing a mask. The final piece that I just have to mention, Chris, is that we know that quarantine and isolation are hard for people. Early on in the pandemic, Commissioner Lambrou and I and our teams set up a variety of social services supports to help people for whom isolation and quarantine were tough. They didn't have a safe place to be. They didn't have access to food. Those services are still available. And we can get more information on that, but if you need help with isolation and quarantine, you're not alone.
Okay, thank you. I know that some other doctors we've spoken to, particularly Northern Light Health had its press briefing today. One of the challenges that they mentioned was getting people to actually follow these guidelines and wearing a mask after their 5-day quarantine or isolation period. And I think even similarly, especially somebody who meets that kind of that standard of being, quote, up to date on their shots, fully boosted or less than 6 months after, so on and so forth. Somebody who feels asymptomatic being like, hey, I feel fine. Why should I quarantine or isolate? Can you explain for people at home, why this is necessary, even if they are asymptomatic?
Sure. So the part of the scientific rationale behind this change was increasing amounts of data that show that the greatest likelihood of transmitting COVID is on the front end of the disease, not on the back end. On the 2 or so days before you start feeling symptoms, and the 2 or 3 days after you start feeling symptoms, or when your symptoms have resolved. That's when the bulk of transmission of COVID happens. But after that day 2 or 3 or 4, it does not fall to 0. There's still a chance on day 4, 5, or even day 6 that you could spread COVID to somebody else. It's a lower chance, and it's a chance that in recognition of the need to have people rejoin their lives and the human desire to be wanting to be around others, we've got to make compromises. That's what this is based on, but that chance doesn't fall to 0. How can you reduce that chance even further, even if you feel fine? By wearing a mask. That's the impact, the import of that mask wearing piece. Your chances of transmitting COVID don't go to 0 the morning of day 6. They're still there, but you can bring them down even lower by wearing a mask. And that's why.
Thank you both.
Thank you, Chris. Patty White, over to you.
Thanks, Dr. Shah and Commissioner Lambrou. We've heard from several schools that contact tracing and quarantining have become pretty exhausting for administrators and school nurses this fall. Do you expect the new guidelines from the CDC will make those workloads easier? And are there any other resources that the state is going to offer schools to kind of help with those duties?
Yep, Patty, starting several weeks, if not months ago, we started hearing about the operational challenges that schools were facing in conducting contact tracing, exposure notification, and then working with students and families on quarantine. It is not easy. We acknowledge that, and we've heard that loud and clear. In recognition of that, Commissioner Lambrew and I, as well as Commissioner Macon from the Department of Education, have been thinking through what we can do in that respect. Actually, not long ago, Commissioner Macon and I met with a set of superintendents to discuss this issue. And there is a move afoot more nationally to rethink the approach to quarantine in light of increasing levels of vaccination, as well as pooled testing, which has been a success in Maine. So we're rethinking what quarantine and contact tracing look like. But we want to do so after seeking the advice and consultation, the operational input from superintendents on the ground. So we're engaging with superintendents to understand what the impact of these decisions around contact tracing might look like and what we can do to balance easing the burden on them, but also keeping kids safe in school. No changes to announce right now, other than to note that we really value that input that we're starting to get from superintendents and look forward to engaging with them further.
Okay, thanks. And with these new guidelines where, reducing the time to quarantine, what's your take on what masks should be used? And I guess I'm thinking of, kids, if they need to quarantine, and I guess anybody else, should they ideally, and that the 5 days where they're supposed to be wearing masks, should those be surgical masks or KN95s?
Okay, got it. So which type of mask should be used? Yes, understood. Patty, I'm increasingly of the view that, and I haven't talked about this yet, but I'm increasingly coming around to the view that we need to be upgrading our masks. I think the older approach of a cloth face covering, probably one. I want to study it and talk to people on my team who are experts in this, but I'm increasingly coming to the view that the old school cloth face coverings, may be time to retire those. And then the bare minimum ought to be a surgical mask. And then also talking about upgrading from there, the so-called KN94s or the KN95s or even the full-on N95. As we learn more about Omicron and how quickly it can be transmitted, upgrading your mask, if you haven't done so already, is something to start thinking about.
Okay, thanks. And just really quickly, so for schools, I guess should schools or the state be providing those masks for students and staff?
I'm not sure. We do provide masks. They I think right now have been the more cloth-faced ones. The surgical masks and others they're not difficult to find, but that doesn't mean that they're easily attainable for everybody. So something we have to look at more, Patty.
Okay, thank you.
Mm-hmm. Let me go to Max Baer from CBS next.
Hi all. Thank you so much for hosting this briefing. My first question is about the FDA and their announcement yesterday warning about the sensitivity of some antigen tests against Omicron. Dr. Shah, have federal officials given you any more specifics about which tests to avoid? And regardless, what's your guidance to residents about how to best use those tests, especially in light of the new CDC guidance?
Yep, thanks, Max. And good to hear from you. Glad to have you join us. So with respect to the latest discussion from the US FDA, yesterday evening, the FDA put out a statement indicating that some of the preliminary tests that they, as well as manufacturers, have run show a decreased sensitivity to picking up the Omicron variant. This was not unexpected. It was thought to be the case, at least for some tests. So what does this mean in light of the questions that Max asked? We have not received a list of which of the tests that have been studied exhibit that decreased sensitivity, nor, and this was a question that I put to federal officials, nor do we have a sense of the magnitude of that decrease in sensitivity. Is it a couple percentage points or is it even more significant than that? So without those two, Max, I don't have good answers in terms of recommendations. What I did hear one federal official say yesterday, however, in a meeting, was that it did not change, in their view, the immediate recommendation of the value of rapid antigen tests. This is not if you've got a test, chuck it out. That is not what's been said. It's more of this is something that we need to study and better quantify so that maybe recommendations, if they need to change, can be done so in the future. I think it would be premature to change any guidance around the use or utility of rapid tests at this time. Something we need to watch further.
Got it. And then my second question is, we are seeing a increase in pediatric hospitalizations with confirmed and suspected COVID in much of the country. Obviously, that's correlated with an increased spread of the Omicron variant. Just wondering if you're seeing similar trends in Maine, and how that's maybe adjusting some of the guidance you're giving out to parents and what they should be looking out for.
Sure thing, Max. And that's certainly been something we've been concerned about. Overall, thankfully, the impact of COVID-19 on kids has not been felt as harshly as it has on adults. But that's not to say that kids are not affected. Right now in Maine, as of this morning, there were at least 6 children who are currently hospitalized in Maine with COVID-19, 3 of whom are in the ICU right now. That number has not changed appreciably in recent days. Indeed, it's actually down just a hair since last week. But Max, as you know, in Maine, our numbers are small. So small numerical differences, even though they mean big things in percentage terms, it's difficult to draw big conclusions from them. We're keeping a very close eye on it in light of the national reports of increased pediatric hospitalization. We haven't thankfully yet seen it, but there too, we're keeping a close eye on it.
Got it. Thank you so much.
Thanks, Max. Let me go to Talia from WMTW.
Good afternoon, Dr. Shah. Thanks again for doing this. And my question was just answered. So thanks anyway.
Great. Thanks, Talia. Mal, over to you.
Oh, you caught me off guard. Okay, so we posed this question to Northern Light earlier today, but when do you expect to see a surge in cases following the holidays?
That is in some respects the key question, Mal. On one hand, we generally look at about a 2-week horizon after big events where people are gathering. And so if you zoom forward a little bit, you're looking at sort of around the 8th or so, 7th or 8th of January, and then another potential peak round about the 14th or 15th. But those are all just based on prior experiences. It's too early to tell whether gatherings were fewer this year because of folks being concerned with Omicron. To say nothing, Mal, of just the really high rates of community transmission that already occur, that are already happening. So disaggregating those things, hard to know. We're prepared either way if that surge were to happen, but let's hope it doesn't.
And I know the FEMA federal ambulance teams just started to arrive just yesterday. Has the state requested any further help for hospitals?
I'll answer that. Yes, we have a request in for clinical teams to do monoclonal antibody administration, as well as pitch in on vaccination. We're hopeful that request would be approved quickly. We also are revisiting some of our previous requests to see if Central Maine or Maine Medical Center or Eastern Maine Medical Center or even some of our rural hospitals need clinical help. As a reminder, the slate of federal resources that President Biden offered included people who could vaccinate, test, as well as clinicians. So we are doing a comprehensive assessment of our needs going into the new year to figure out what, if any, additional requests we make.
And then I just have one last question, and either of you can answer this. Northern Light is really concerned about just how transmissible Omicron is, knowing that so far it seems like people's cases have been mild, but just with the sheer magnitude of how many cases could be brought on, that could lead to a dramatic increase in hospitalizations, even if most cases are not severe. Do you share that concern?
Yes, sorry, Commissioner. Yes, the short answer there, Mal, is yes. When it comes to the stress and strain on hospitalizations, it's contagiousness more than severity that drives that strain. As you noted, Mal, even a rare thing when it comes to COVID, if a lot more people are infected because it's more transmissible, like Omicron, even if the thing we're concerned about, landing in the hospital or an ICU, is a little less likely, if more people are getting infected, in numerical terms, that can translate to more people needing intensive care and thus more strain and stress on our healthcare workers. So yes, we share that concern. It's too early to tell yet what the data will shake out there to be, but based on what we know right now about the higher transmission rate, it's a concern.
Okay, thank you.
Thanks, Mel. Sean Murphy, over to you.
Hi, Dr. Shaw and Commissioner Lambert. Thanks for the time. Just wanted to ask a couple of questions about Omicron as well. Could you, first of all, clarify the 2.2% number you mentioned earlier? And just that you said that number is undoubtedly higher now. How often do you update that figure? And are you testing for this constantly? Do you test out of state or locally? Could you just explain a little bit of that?
Yeah, sure thing, Sean. So that number comes from our genomic sequencing partnership with the Jackson Laboratories. The number is updated once a week, usually on Fridays, sometimes a day before, sometimes a day or two after. And the way that it works is that we work with Jackson to send a geographically representative sample of positive results that we receive at our laboratory over to them to do that really, really particular DNA, RNA fingerprinting to tell whether the virus in question is Delta, Alpha, Omicron, et cetera. The 2.2% figure is as of last Friday's report. Again, given what we know about how quickly Omicron spreads, that number is definitely higher now, but we won't know exactly what the new floor is until we get this week's report, which will be a bit later in the week. Genomic sequencing is a little bit different from the diagnostic PCR testing that we've all grown so used to hearing about. Genomic sequencing is much more intensive, requires really heavy duty computing power, and is something that's really done more at specialized laboratories like our colleagues at JAX.
So you said 2.2% of the cases currently are the Omicron variant. I'm just curious as to, we're seeing some evidence in other states about how the Omicron variant has come on so strongly that they're really not seeing Delta anymore. And I know you were concerned about Delta versus Omicron. Do you think that there's a possibility that Omicron at some point will overtake Delta and become the dominant strain? And if so, would that be a good thing, given that some have said that the Omicron variant isn't necessarily strong?
Yeah, it definitely I would not characterize as a good thing. A highly transmissible variant of any sort that lands people sick, out of work, in the hospital, never a good thing. But I hear your point, Sean. So let me talk about the outcompeting possibility. Based on what we know right now, Omicron seems to be able to hold its own against Delta, and in many parts of the world, even gain the upper hand, like in South Africa, like in Denmark, like in the UK. Those countries are in some respects different from the US, especially Maine, where our vaccination rates and our booster rates are quite robust. The same applies with Israel. It's too early to tell whether Omicron will definitely outcompete Delta, whether it'll just give it a good run for its money, or whether it'll just linger where Delta will remain dominant. It's unclear which of those scenarios will manifest. Each of them has good, strong odds. But let me just say, Sean, none of those is a good scenario. Omicron, even if it does turn out to be less severe on an individual basis, because as Mal and I were just talking about, because it's more transmissible, could actually lead to more strain on the healthcare system. More strain on the healthcare system does no one any good. It means that if you fall and break your leg, it may be that much harder to find transport or an ED bed. It means that if your partner needs surgery for something that's not COVID related, it might be delayed. So each of these scenarios is concerning.
Thank you. Very, very lastly, do you think the Omicron variant is a bigger concern with infants, youth, and younger kids as opposed to Delta?
It's too early to tell. There is some concern, as you heard me mention in connection with Max Baer's question, around increasing hospitalization rates among younger kids across the country, whether that's a direct function of Omicron or whether it's a byproduct of the fact that their vaccination rates are just a bit lower. Too early to tell. We really do need more data on the intersection of Omicron and young kids.
Okay, thank you very much.
Thanks. Allegra, over to you.
Hi, Dr. Shaw. I know last week we had asked about sort of survival rates, if you will, off of ventilators, people who are on ventilators, and we were just wondering if you had an update on that for us.
I do, but I don't have it in my notes. So I will check with our medical officers to see what the numbers were. I did ask them to try to get a sense nationally of what the literature shows, as well as if we have a sense of those findings in Maine. I don't have that in my notes today, Allegra, so I'll check with our medical officers and see where we are.
Great, thank you. And then one last question is just, as we see these, the CDC guidance is changing and, isolation, quarantine things sort of being cut in half, if you will, for those, vaccinated and boosted. What does this tell you about us being any step closer to just simply living with COVID and carrying on about our lives eventually?
Yeah, it's easy to kind of take a look at these new updated US CDC guidelines, Allegra, and say, well, this is just evidence that federal health officials are throwing up their hands. And I see why folks have indicated that or gotten that impression. I don't know that that's exactly right, though. What these guidelines are at least largely based on is a recognition that COVID is really more of a front-end phenomenon when it comes to transmitting it, rather than a back-end phenomenon. The peak of your transmissibility is really more the day or two before you get sick, and then the 2 or 3 days after you've had symptoms. After that, the likelihood of transmitting it to somebody really does go down significantly, especially and importantly, if they're wearing a mask. Was this in part motivated by a desire to get people back to rejoin their lives, back with their family? I have no doubt that it was, and Dr. Walensky indicated as much to the media yesterday and this morning, but it's also important not to lose sight of the scientific predicate here. I don't think this is evidence of everyone just throwing up their hands, but I can see where folks get that impression.
Great, thank you so much.
Thanks, Allegra. And the last question for the afternoon goes to Rebecca from the Ellsworth American.
Yes. Hi, Dr. Shaw. Thank you. I just have a quick clarifying question. When you said that the new isolation and quarantine guidelines for schools applies, is that effective immediately, when kids come back from holiday break?
It will be effective shortly into the new year. The US CDC is looking to put out a little bit of an expansion to the document that they put out on Monday. They want to address some nuanced scenarios. For example, what might this mean for congregate living settings? I understand that they also want to provide a little bit more granularity around schools. So Rebecca, it will apply very, very shortly, but we're talking days, not weeks.
Great, thank you.
Great, thank you. Commissioner, any final words before we wrap things up for the year?
Except for it's been a interesting year, a challenging year with COVID-19. I think 2022 will bring its own twists and turns, but we do want to pause and wish everybody health and happiness as we enter this new year.
Great, thank you, Commissioner. I mentioned this at the top, but as I was working this morning with our stalwart communications director, Robert Long, someone that many of you know, he observed that we are, as I mentioned at the top, about to go into the 4th calendar year of COVID-19. And at first he said it, and I actually didn't believe him. I thought that maybe there was a communication breakdown somewhere, but as I counted it out, sure enough, we'll be going into the 3rd year of the pandemic and the 4th calendar year. I wanted to take just a quick moment to thank somebody who has been with us and their team who's been with us from day one of these briefings, since very, very early on. And that's your interpreter today, Josh Seal. Josh and the team at Pine Tree Society have been with us throughout these briefings. And Josh and your team, I'd like to thank you for interpreting these briefings for us. Josh and his colleagues have interpreted thousands of questions and answers and have thus provided incredibly valuable service to Mainers as well as others who have tuned into these. So Josh, to you and your team at Pine Tree, we thank you for being with us all this time. And then as the commissioner mentioned, we're signing off for the year, but we will be back in 2022. Until then, have a great year. Happy New Year. Be safe, be smart, be healthy. Thank you all very much.